RC139.
You are now the closest car to Docklands for a road traffic accident. Patient on alert, code 0 code 1.
RC139, receive code 1. So we've been dispatched to a traffic accident, 55-year-old female, came across 2 lanes in a car, fluid leaking from the car, patient seizing. That's pretty serious.
Yeah.
Multiple things going on there. We've got a trauma with a medical condition.
Heading to this job, our main concerns are why has she had the seizure? Does she have a history of seizures? Has she hit her head? Is there trauma to her and her body at the moment?
Obviously, we've got to check other people involved.
Yeah.
There's going to be a lot going on.
Due to the urgency of the case, 2 single responder MICA units have already been called to the scene.
So our MICA paramedics have a lot more skills than us, and they've got a lot of other drugs that we don't carry, so we need their expertise in priority 0 situations.
Oh, they're both there.
Yes. Jeepers. She's gone up the rocks.
Oh. Are you serious? Hey, how are you?
Just lay back, it's all good.
Risky and Nicola have arrived at the scene of an unusual car accident on the side of a freeway near Melbourne city centre.
Can help you in the back if you like.
Come on. Nice and still for me. Nice and still. Just don't put a collar on you.
MICA paramedics are trying to calm the disoriented 55-year-old female driver.
The car's travelled across multiple lanes of traffic at speed and launched onto the rocks, and it's pretty clear that she's obviously had a medical episode of some kind.
It looks like she's post-ictal. She's
Yeah.
got a good chew on her tongue.
Yeah.
We think the patient's post-ictal, which means she's had a seizure and now the seizure activity has stopped, but she's confused and not orientated.
I might try and get the bed just as close as possible. I'm going to try and get it in there.
Yeah. Did anyone else get hit or anyone? No one else?
There's no one.
Okay, cool.
Witnesses rushed to the driver's aid and were able to rescue the patient's dogs, who seem uninjured.
The patient looks agitated. MICA are trying to keep her C-spine protected, but it's really, really difficult to get her to do things that we need her to do for her own safety.
Hello, you okay? Bring your legs this way. Come on. Come on.
The paramedics must begin the delicate task of transferring the patient to a stretcher.
I can move the bed to here once we've got room.
When she's out of here, we're going to assess her.
Do it properly.
Yeah, let's get her out.
It's really important for us to get her out of the car, to immobilise her spine, to prevent any further damage and any further movement.
Come on. Nice and still. It's all good.
But it's really difficult because you're basically talking to someone who's still moving around and not processing what you're saying.
She's behaving like she's got a head injury, so we need to be real careful.
Just popping some seatbelts on.
Okay.
After helping remove a 55-year-old driver from her car, Risky and Nicola are now trying to calm the distressed patient.
Just try and lie still. Lie still, okay? We've got you.
They've said that she's come from over that intersection straight across here with no deceleration.
Through, yeah.
Probably unconscious for that.
The patient's behaviour is quite unusual. She's really emotional and distressed, so this increases the concern that she has a potential traumatic brain injury.
It's okay.
You're okay. You're okay.
Her name?
Let's just let her get into a position of comfort. Hopefully,
Okay, I'll loosen it for you, sweetie. I'll loosen it.
So the patient's still confused. She's still agitated from something that's gone on. We're going to continue trying to calm her down and reassure her, because being post-ictal, it takes a while to regain full consciousness, so we need to keep trying.
Hello, my name's Matt. Bring your arm down. Hello. Hello, I'm Gavin. This is Gavin. Okay? You've been in a car accident, right? What's your name?
So both the MICA paramedics are in the back with the patient now because it's still unknown what's going on with her. It could be a simple seizure, but it could also be a bleed on her brain that could cause her to stop breathing. So we need their skills in case that happens.
I just got a little bit more story about.
Oh, yeah, yep.
So she's at the lights over here. The light's green. She's been stationary, even though the light was green, and then suddenly accelerated straight across the median strip into these lanes, up that first lot of rocks into the air, and landed where the car is there.
So whatever's happened has happened over there at the lights.
When I find out that this vehicle has gotten air, it indicates to me that the speed must have been quite high and the impact has been really significant. We need to be really careful because of the potential for a spinal cord injury, but also we don't know what other injuries may be present.
Ready?
Yeah, very, very, very gentle, code 1. What was your name?
Helen.
Thanks, Helen.
While car accident victim Helen has finally remembered her name, it's critical, risky, and two Micah paramedics get her to the Royal Melbourne Hospital quickly.
What's the last thing you remember today?
I don't know.
You were driving. Do you remember where you were going?
No.
How old are you?
I don't know.
You don't know? Okay, it's okay if you can't remember.
The Micah paramedics are asking these questions because they need to know where she is in her cognitive state at the moment. Has she fully recovered or is she still confused? Is this just postictal or is it more serious than what we think?
Helen, have you ever had a seizure before?
Seizure?
Yeah. Do you have epilepsy? Do you take any regular medicines?
No.
No.
Probably the number one cause of seizures is epilepsy. A lot of people have epilepsy and are medicated for it, but there's other causes of seizures. It could be a bleed on the brain, could be a brain tumour. I kind of hope for her that it's an epileptic seizure because they are better controlled with medication and you can live a full normal life with epilepsy, whereas a bleed on the brain and brain tumour are life-threatening conditions.
Do you live by yourself?
No.
No? Do you have kids?
Yep.
Yep. How many kids do you have? Don't know?
No.
That's okay.
Have you got staffies?
Yes.
Yeah. What are their names?
Billy and Fred.
Excellent. They're beautiful puppy dogs. So we're here at the Royal Melbourne. What we're going to do is we're going to wander in now, okay? You just stay back and relax, okay? And Gavin and I'll take good care of you, all right?
All right.
You're okay though, you're safe? But you've just had a bit of a car accident. Okay?
Have I?
Yeah. Relax,
Okay.
okay? Here's Gav. He's just going to open up the doors for you. There you go, mate. Yeah, mate.
Now that we've arrived at the Royal Melbourne, the team will be ready to take Helen into a resus cubicle to conduct further investigations.
Just lay back, It's all good.
55-year-old Helen was driving home from a dog show with her beloved Staffordshire Bull Terriers when she suffered a seizure, crossing a number of lanes of traffic, launching her car onto rocks.
Okay, I'll loosen it for you, sweetie. I'll loosen it.
It was a miracle she survived the crash, but the paramedics wanted to get her to hospital quickly to find out what was happening in her brain.
Ready?
Yeah, very, very, very gentle, code 1.
In the emergency room, Helen suffered 2 more seizures. 2 months on,
Oh, here's Mum.
and with her son and her beloved canines by her side, life is slowly returning to normal for Helen.
How are you feeling?
Yeah, I'm okay. Hey, how are you guys? At this time, I have been able to walk just one dog, and then my son James helps me with Fred, and we're able to go on walks together.
You're a good girl, Billy, aren't you? Yeah.
In the near future, I'll be able to get back to walking them by myself.
How's the back feeling?
Yeah, it's not too bad.
Yep.
Hopefully soon I'll be able to take both of them.
Helen has been diagnosed with epilepsy and has severe back pain after crushing her vertebrae in the crash. But she knows it could have been far worse.
I definitely think that Someone was looking down at me that day. It is a miracle that I didn't injure somebody else or kill myself and the dogs. I've had another chance at life, that's for sure.
We are going to a patient who's unconscious after being assaulted. We've got 10 to 20 males hitting one male. They're still hitting him. The male is on the ground in the middle of the road holding his head.
Eamon and Mike are now being dispatched to help a teenager who's been attacked by a gang in Melbourne's West.
Job, do we know if 56 are on scene and if it's safe for us to approach?
I ask if the police are there because if it's not safe, we're not going in. If we get taken out of action, we can't help anyone else.
They are definitely on scene, however, there was report
139, Roger. We're 500 metres away. We'll come up with an early sit rep.
The job is quickly escalated to a priority 0, the highest alert on the paramedic scale.
So I'm not sure why this has gone up to a priority 0. That usually means that they're not breathing.
The team arrived to find a heavy police presence at the scene.
Hey.
One closest to us needs the most attention.
The gang members have disappeared, but their 2 victims are lying helpless on the ground.
RC 139, can we please get one of the micers over? We've got at least 2 patients down on the ground, unknown conscious breathing. You want to take that one over there? I'll look at this one.
As Eamon approaches the first victim, he's shocked by the sheer brutality of the attack.
All right, I don't want you to move too much. I'm just going to have a good look at you.
When I first get to the patient, I can see how bloodied and bruised he is. And it's obvious that they've targeted his head.
I haven't found any other injuries other than these facial wounds.
Let's get him on his back, please. Can you open your eyes for me?
Across the road, Mike's patient is critical and non-responsive.
Mate, just try and keep your head still for me, all right? It's ambulance service. We're here to help you out.
I can't actually see him moving at all. I thought, oh, is this guy dead?
I think he's got blood coming from his ears. Obvious head injury. GCS, I've got him as a 7.
This guy is definitely not talking to me. He's not opening his eyes when I'm yelling at him.
Talk to me, what's your name?
That tells me that he is really unconscious, and that's going to be because of his serious head injury.
We've got a lot of really smart people here. They're going to take great care of you, okay, mate?
Nice and still, mate. Nice and still, nice and still. You stay back. That's it.
You just relax, my friend.
We're going to help you up in a moment.
I'm unconscious.
Not quite yet.
While Eamon's patient is now able to speak with the paramedics,
Eamon? Yeah? I'll need a hand over here.
Mike is calling his partner for backup.
Are you guys happy? I'll head back with my partner. You guys happy there?
Open your eyes up for me, buddy. He's now starting to perk up a bit. There is obs 128 on 77. Yeah, mate, we're going to load into 13. You're going to feel a bit of moving around.
Bring that arm up there, mate.
Hey, it's okay. Everyone ready. Ready, set, go. Walking down to the bed, go. Prepare to lower, ready, set, go. We'll get that board out and we'll strap him down and go. Matey, keep your hands in for me. I haven't been able to look at his pupils because one of his eyes is swollen shut. You're doing really well.
My patient was critically unwell. He's deeply unconscious. He might need a breathing tube to help support his airway.
It's all going to be okay.
He's got maybe some bleeding or swelling in his brain. He's just had the absolute snot beaten out of him by this roaming gang for a phone and a couple of bucks by the sounds of things.
Lay back for me. It's all good. Here we go. It's going to be a few noises.
So it makes me a bit angry to think we live in a world where some people think that it's acceptable to do that, but obviously we can't show that in front of our patient.
I think we're squared away here. Can I pass you that fluid? That is primed and ready to go.
In Melbourne's West, Mike is handing over his critically ill patient to an intensive care team. The victim of a late-night attack is now being taken to the nearest trauma centre.
Foxy,
yep.
I've got a patient.
Yeah.
Now, Mike and Eamon need to turn their attention to the other casualty, who was also kicked in the head and left to die.
So we'll load and we'll go from there.
What a wrong friend.
He's all right, mate.
He's
the other
okay.
guys are looking after him.
All right, we're loading into the ambulance, mate. What was your name?
Daniel.
All right, we're going to take you up to the hospital. How old are you?
Do you want me to keep my eyes open?
Whatever's comfortable for you. I just don't want you to move your head, okay?
I'm going to help hold it. My name's Mike, sorry, one of the other paramedics. Just relax your head back. You don't need to.
You don't need to. Keep it back. That's it.
All right, we're going to take good care of you, mate.
Mate, I'm going to have to cut your pants, I'm sorry.
I just want to have a good look at you, okay?
No, I'm thinking, I just got...
Yeah, I know, but you've been belted across the head, so you're not thinking as clearly as you normally would, okay, yeah?
Belted, no, I just got kicked.
Kicked, I know. These people weren't holding back. They were hitting him as hard as they possibly could. Daniel could have died. All right, nothing sore there, mate? All right, nothing sore in your groins?
Just my head.
Just your head. All right, let's get you a little bit covered up.
Which hospital are you guys taking me to?
The Royal Children's, mate.
Is my friend coming to the same hospital as I am?
He's going to another hospital because he's a little bit older. So he's 16. Is he?
No, I have to go to the same hospital as he is.
Hey, I want you to worry about you at the moment, mate. You get to see your friend.
I have to worry about my friend first.
Daniel is one of the most severely beaten patients that I've come across, and yet he's not worried about his pain. He's not worried about the bleeding and the bruising. He just wants to make sure his friend's going to be okay.
What about my friend?
He's okay. I can tell you that some of the very best paramedics in the state are looking after him, all right?
Are you guys the cops or the paramedics?
We're the paramedics, mate. We're paramedics.
Because when a girl, I want to be a cop.
You want to be a cop? That's good. Why do you want to be a cop?
Because I've always looked up to them.
You're a good man. I reckon you'll be a good cop. There you go, mate. Keep this on your face for me.
I can breathe down.
I know you can.
We're just erring on the side of caution, okay? So there's a lot to do for this patient. I need to spinally immobilise him. I need to get some high-flow oxygen on him. I need to get some IV access so I can give him medication that's going to stop him from vomiting. Because if that patient vomits, it could increase the pressures in his brain and he could also choke on that vomit. And both of those things are so dangerous for him.
Eamon, you've got the car keys, mate. There's a lot of urgency for transporting Daniel because he's been unconscious for we're not sure how long. He's also got serious head injuries. His face is blown out to the side, his ears massive. Head back, mate, head back. We're going to transport him as quickly and safely as we can to a major trauma centre. We're not going to muck around, it's going to be lights and sirens. ETA is 15 minutes.
15, brilliant. How's that pain?
Good.
Are you sure I can't give you anything for it?
No.
Because you look pretty sore, mate. You've had a pretty significant knock tonight, okay? So I don't want you to be stoked. There's nothing wrong with saying, I just want a bit of pain relief, okay?
Don't worry, I can take care of it.
All right.
Eamon and Mike are transporting the brave teenage victim of a gang attack to the emergency department at the Royal Children's Hospital. 15-year-old Daniel may have serious head injuries after being kicked repeatedly.
What happened tonight?
I was walking around, my friend was, they jumped us.
They just jumped you?
Yeah.
Did you do anything to provoke them, or did anything happen?
They started kicking my friend, so I started caring about my friend's face. So then I just got on top of him, and then I covered his face.
He's jumped in to help his friends despite some overwhelming danger.
I was going to fight those people because he was getting kicked.
And they just started kicking you. So what year? Are you in year 10 or 11?
11.
11. VCE?
Yeah.
That's where it's getting hard, hey?
When a girl, I want to be a cop.
This teenager has run in to protect his mate against literally a mob of people. If he was in a service, that'd get him a medal.
Your breathing still feels the same?
Yeah.
Okay. You haven't developed any pain anywhere else?
No.
Okay. It's just in your head. Where specifically in your head?
My cranium.
Your cranium, so around the top, okay?
He knows all the words.
I know where my rectus abdominis.
Your rectus abdominis, that's all right.
My hamstring.
Your hamstrings, you're all over it, mate. You could be a paramedic.
Yeah, forget being a copper, be an ambo.
Daniel will now be taken for urgent scans to assess whether he suffered any brain damage.
Hi, mate. I think you can walk away from these jobs and you can choose to focus on the savageness and the heartlessness of it all.
Just try and keep that head still for me.
But instead, I choose to focus on Daniel and how brave he was and how stoic he was and how much he fought for his mate. That's what I walk away from this job with.
Man, when I went up to that guy, I thought he was dead. He was brutal.
Disgusting. Daniel's what, 15?
He's just a kid. It's messed up.
Yeah.
And the reason he got beat up was because they were laying into his mate's head. He went in to protect his mate and, you know, who knows if it actually made a difference. And if it's actually saved his mate that fatal blow, and he will be a cop. I don't reckon anything will stop that boy. Good on him. We need police like that.
Are you guys the cops or the paramedics?
We're the paramedics, mate. We're paramedics.
Teenager Daniel was cleared of any long-term head injuries after being brutally assaulted by a gang. He is now fully recovered.
Head back, mate.
Since the attack, the young hero has celebrated his 16th birthday and is even more determined to follow his dream of becoming a policeman.
When the girls, I want to be a cop.
All right, is he awake at the moment?
Is he awake? No.
Is he breathing?
His lips are blue and he's all white and he's leaking blood and he's unconscious.
Micah paramedic Cam is sent on a priority 0, the most urgent call out of all.
The problem with blood is it's easy to fall out, but we can't put it back in. Worst case scenario is you could die. Who knows what kind of scene we're about to walk into. Hopefully he's not still stuck in the window.
But another crew has already found the man collapsed in the backyard. He's drifting in and out of consciousness.
G'day, my name's Cam. Sammy, are we going to be right to just go, mate?
I'd say so, mate. We haven't got access yet. I just want to get him on and get him in.
Yeah. What's his name?
Jared.
There's so much blood. He's definitely hit an artery or a major vessel, and I start thinking he could be bleeding out in front of us right now. Can he stand or not at all? Yeah, okay.
Intensive care paramedic Cam is worried 28-year-old Jared has severed an artery in his arm after crashing through a plate glass window.
Just relax, mate. We're going to get you into the ambulance, okay?
That's it, mate.
Before he can be rushed to hospital, the paramedics need to check him for more injuries. If he's lost too much blood, Jared could die.
Oh, there's a lot of blood on there from something.
Yeah, he might have bled down onto it, so...
Yeah, rolling. Yep.
Okay, let's go. Just monitor off.
Yep, that's it, mate. We're going to take care of you. Roll on your side.
Okay.
Nothing wrong. Okay.
All good,
Down
thank
we
you.
go.
Sam and Lauren have done an amazing job. They'd put a combat tourniquet on Jared's arm, but there's blood all over the ground. There's blood on the porch. There's blood everywhere.
Jared's mum, Julie, called paramedics after finding her son unconscious in the backyard.
When I found him, he wasn't in a good way at all. He'd had a terrible blood loss. It was quite clear that he was in a lot of trouble.
Can you give us a hand just to lift him up onto here, please?
On his side.
Just watch your back there as well, mate. Okay, we're just on the sides like this.
As a parent, I'm watching my son hurt and just praying that he's going to make it through.
Put your foot in.
That's it. And down we go.
Okay.
Keep your arms in, mate. We're trying to help.
Jared, put your arms down, mate. We're going to give you some oxygen in the back of the ambulance, okay, Jared? Pop your arms in for me, mate.
Single responder Cam is desperately working to get Jared to hospital after the 28-year-old smashed his arm through a window.
It sounds as though he's lost enough blood that he needs it replaced. I don't have blood on the ambulance, so I'm thinking, whatever we do, let's get moving.
Just relax, it's all right.
Dad Alan tried to stem the bleeding using his shirt as a bandage.
It was absolutely pouring out, coming out of his arm probably that far. He was in a really, really bad way. And he just kept saying, I love you, Dad. I said, I love you too, mate.
Okay, mate.
Okay, mate. You're doing well. Keep your arms in, mate. We're trying to help, okay?
Nobody knows what caused Jared's accident today.
He'd been drinking pretty heavy through the day, been doing it for a few days, and came in very argumentative, had a little bit of an argument with me. I don't really know what actually happened then.
Hey, Jared. Jared, open your eyes.
Jared desperately needs a blood transfusion at hospital. Until then, all Cam can do is give fluids through a drip.
Jared. Jared, open your eyes for me, mate.
It's really hard to deal with Jared because he's distressed and agitated, and I don't know if it's just he hasn't got enough blood pressure to the head or something else is going on.
Cam,
Yeah.
what's history of amphetamine use? He may be using today.
Okay, thank you. He's got a little bit of the sweats. No obvious head injury. Okay, I'm going to need a hand just to get the IV in. Jared, I've got to put a little needle in, but you need to stay really still for me. Jared's not really compliant to my instructions. Still, mate, still. Jared. I need to get this needle in his arm so I can give him some fluid. If he continues to deteriorate, worst case is he's lost so much blood, he might even go into cardiac arrest. Really, still?
Stay nice and still, mate. Don't move. Don't move.
Jared. Hey, you're doing really well, mate. I'm trying to fix you. You put a really nasty cut in your arm. Do you understand?
Under lights and sirens to hospital, Cam is finally getting life-saving fluids into Jared after a massive loss of blood.
So that's running through nicely, mate.
Yeah, so I just want to give him 250 mils and then reassess.
The 28-year-old has been agitated since smashing into a window at his parents' house.
His dad did say that he might be ice-affected as well.
He's got the alcohol breath as well.
Yeah. He seemed quite intoxicated when we got there. You know, if all of our patients were compliant and followed our instructions, it'd be great. But often people are affected by drugs or alcohol, and they're often the most challenging cases we do.
Hey, mate, you're in the ambulance. Can you hear me? Not if you can hear me, mate. Good man.
If that's his true blood pressure, mate, I'm happy to put another 250 mils in. We didn't really get much improvement with it.
If he's to survive, Jared urgently needs a blood transfusion.
Hey, Jared, we're at the hospital. Do you understand? Lost a bit of blood putting your arm through the window, mate.
It's the last in a long line of dramas for Jared's long-suffering loved ones.
Jared was having a really bad time leading up to this. His drinking was putting a lot of pressure on our family.
Okay, nice and easy.
We went through some very, very bad periods. He was on the ice. Unless you've been a parent, you've been through it, people won't understand it.
Off you go. Yep.
As they arrive at the emergency department, the anxious wait begins to see if Jared's troubled life can be saved.
My biggest fear for Jared is that he's not going to make it. It definitely is every mother's worst nightmare.
Hang on, Jared.
And it's now 3 months since Jared nearly bled to death after crashing through a window at his parents' home.
Apparently I lost 7 litres of blood and yeah, my body was shutting down. They told me that I actually died. The doctors had done an amazing job to keep me alive.
You reckon he's grown since the last time you seen him?
He has grown.
Jared had a blood transfusion, 4 operations and a skin graft.
How you feeling, mate? How's your arm?
There's no feeling through here. I got feeling in my thumb. The doctors just told me it's going to be a long 12 to 18 months before they know what operations they can do on it and what feeling I'm going to have in it.
Sensation having you back helping again, mate.
I'm glad to be back, Dad. I've missed it. Me and Dad had a bit of an argument, and it was an argument about work. I lost my temper. I put my hand through a window, and that's how I done the accident. That's how I lost the blood. So, yeah. Good boy.
I did think that we were going to lose him that night. But he's off the alcohol, he's off the drugs, and as parents, we couldn't be happier.
It's good to be back around the horses, isn't it? This accident's been a real eye-opener to me. It showed me how important life is to you, how much your loved ones are worth to you, and I'm just grateful and happy to be alive.
Come a long way.
Happy birthday.
Emergency services, tell me exactly what happened.
I don't know the lady, but she can't breathe very well. She's really gasping.
In Melbourne's northern suburbs, A worried member of the public has called emergency services after finding an 85-year-old woman struggling for breath.
Her lips are quite pale.
Is she clammy?
Yes, she's clammy.
Okay, so just organising some help for you. Just keep reassuring her, all right?
As a priority zero, paramedics Nicola and Risky know this case could be a matter of life or death.
An 85-year-old female struggling to breathe. Doesn't sound good.
No. Priority zeros are the highest acuity cases we get dispatched to, so they're generally cardiac arrest, respiratory cases that are altered conscious state. It's basically people that are dying.
Clear left here.
Because the patient is so critically ill, multiple crews will be sent to help. But Nicola and Risky are the first to arrive.
There they are.
Respiratory jobs make me anxious. With someone in front of you that's struggling to breathe, you feel like you have to get in there and treat them straight away, whereas in actual fact, you need to do a proper assessment so that they actually have the best outcome.
Hello. What's your name? Marjorie. Marjorie, I'm Michelle. What's happening?
Just did some shopping.
Okay.
I know I couldn't breathe.
All right, so just relax your breathing. I'm going to have a listen to your chest, okay?
Worried bystanders called paramedics after finding Marjorie gasping for air at the wheel of her car.
The lady was tooting her horn, so we came over to see what was wrong, and she was struggling to breathe. She was in obvious distress, and she said, "Help me, help me."
Just nice and slow. It's okay. She looks quite blue. Yeah, I know. I'll get some O2 on it.
Marjorie's fingertips and lips being blue, that clearly means she's not getting enough oxygen.
But Marjorie's problems could have an even more worrying underlying cause.
When the heart fails to pump effectively, it has a build-up of pressure which pushes fluid into the lungs. And that's what I think that is happening with Marjorie today.
It sounds like full field crackles.
Yeah.
Full field crackles is a sign to us that the patient has fluid all the way to the top of their lungs, and she's essentially drowning from the inside.
Just focus on your breathing, all right? And just try and remain nice and still for us, okay?
Back in the northern suburbs, Risky and Nicola are urgently administering oxygen to 85-year-old Marjorie and have been joined by specialist Micah paramedic James.
Now, so do you have any heart problems?
Yes, I've got a pacemaker.
We've got a pacemaker.
With fluid-filled lungs and a failing heart, Marjorie's situation is critical. But before they can escalate treatment, they need to get her out of the car.
Any heart attack before? Yes?
We need to be really careful with these patients because the smallest amount of movement from them can tip them over the edge.
Just leave all that there for the moment, okay?
Don't want to put too much strain on the heart that's already under a lot of stress.
We're going to slide this under your bottom, okay? That's it. Now, we're going to slide you onto our bed, okay? You're right there.
Ready? 1, 2, 3. That's it.
Marjorie could go into cardiac arrest any time and urgently needs hospital care.
Is your breathing feeling any better with that on?
Not much.
Not much, okay.
But while she's made it safely to the back of the ambulance, for now, they're unable to take her any further.
Marjorie's one of the sickest patients I've seen, but before we can get her to hospital, we need to actually make sure that she's stable enough that she's going to make it all the way there, because at this point, without any intervention, she may not make it.
85-year-old Marjorie's lungs are filling with fluid, and her failing heart could go into arrest any time.
It's rattling your chest.
It is, because it's fluid in there.
I'm going to put some tablets under your tongue, okay? Just lift up your tongue. That's it. And leave them there and just let them fizzle away, okay?
Medication will help lower Marjorie's blood pressure, but the team must get more oxygen into her lungs if they're to save her life.
I'm going to swap the mask over, okay? We're going to give you a bigger one. This one's going to feel a bit uncomfortable. Okay. What this mask does is it has continuous pressure going into the lungs, which forces those air sacs open so you can get more oxygen being transferred into the blood.
How are you feeling, Marjorie? Is the breathing feeling a bit better? Okay, all right. Let's get going.
With the specialised mask forcing oxygen into her lungs, Marjorie's breathing stabilises enough for her to make the journey to hospital. But she's not in the clear yet.
Driving to hospital, lights and sirens with a critical patient in the back, I don't think I fully relax until I'm through those hospital doors.
That's really good. You're doing really well.
Elderly patients don't tend to bounce back as fast. So even though our management might be working, they're still critically ill patients. You know, there's still things going wrong, in this case, her heart. You know, you just hope for them that they can get better, but we know in reality that isn't always the case.
Marjorie will now be rushed to the emergency department for urgent treatment by cardiac specialists.
Nice flowers, I like these ones.
Carnations.
It's just 24 hours since Risky and Nicola were called to help 85-year-old Marjorie as she struggled to breathe at the wheel of her car. With a failing heart and fluid-filled lungs, the odds were against her making a full recovery.
Hi, Marjorie.
Let ambulance driver.
There you go.
But Marjorie has proved to be exceptional.
How are you feeling?
Thanks, love. Oh, much better, thanks.
You're looking a lot better.
Oh, yeah.
Yeah.
There's no way I could breathe.
Yeah.
And I just felt all the fluid rattling in my throat and my chest.
Yeah, we could hear
I
it.
just couldn't breathe.
Marjorie's really lucky that all the circumstances came together as they did. I mean, she was on her own. She got short of breath. She didn't have a way of calling the ambulance herself. So to see her looking like this today is amazing. She looks like a different person.
Tests showed one of Marjorie's heart valves was faulty. If she hadn't alerted passers-by as she did, she might not have survived.
You were the sickest patient we've been to for a while. You were really unwell.
Oh, well, let's see, that proves you can do it. You can do miracles.
But you helped yourself as well by tooting the horn. So if you hadn't have tooted the horn, Marjorie, you know, things could be different. So good on you as well, yeah?
Right.
Yeah.
I try to be a bit sensible sometimes.
Yeah.
So as much as respiratory patients scare me sometimes, seeing Marjorie sitting up with a big smile on her face was such a satisfying moment. To know that she's actually continued to get better, that's a sense of achievement. You know, that's what we joined this job for.
Thank you, Marjorie.
You're doing a really wonderful job. I'll never forget your kindness to me.
Glad we can make a difference.
You certainly do.
Don't you love this intersection?
As dusk falls in Melbourne, Amanda and Leonard have teamed up for a night shift. But peak hour traffic has them both on edge as they head lights and sirens to a Code 1 case.
So, Amanda, we're going to a 72-year-old male who's complaining of pain in chest.
Yeah.
Doesn't have any aspirin on him. As soon as I hear 72-year-old with chest pain, the first thing that comes to mind is a possible heart attack. Cardiovascular disease is the biggest killer in Australia. And when we're talking about people in their 70s, it's an even higher risk. Knock, knock, ambulance. Very dark in here. You in here, sir?
Is there some lights?
Can't see a single thing. There we go. Hello?
The team arrives to find their patient huddled under a quilt in his bed.
What's your name? Ravi. Tell us what's happening today.
Chest pain.
And when did this chest pain start?
A couple of hours ago.
And what were you doing when the chest pain started?
I was watching playing IPL cricket.
Watching IPL cricket?
Yeah.
Were you getting overly excited at the cricket? No. So you're watching cricket and the pain started suddenly or did it gradually start?
Started from my left side and then it came in middle of my...
Okay. And right now, is it just in the middle?
Yeah.
Does it go anywhere else at the moment? Is it...
Back.
Your back. Okay.
Their first priority is to run an ECG test and assess exactly what's going on with 72-year-old Ravi's heart.
From what Ravi is describing, he has the classic symptoms of a heart attack. Left-sided chest pain radiating into his back. We need to be treating this really seriously.
Ravi, if you could rate the pain right now, that heaviness, out of 10, what would you say the pain is right now?
8.
8.
Leonard and Amanda now have the results of 72-year-old Ravi's ECG. He's called them with chest pains, terrified he could be having a heart attack.
There's a little bit of T-wave depression in AVR.
Yeah.
Other than that, it looks pretty normal.
So far, there's no obvious cause for concern, but Ravi isn't exactly reassured.
We're just trying to work out.
Basically, we've just said nothing looks too bad, but you need to go to hospital. Okay?
When we conduct an ECG on Ravi, it's not indicating that he's having a heart attack. But at the same time, the results are never definitive. We still need to get a blood test at hospital.
I'm losing myself.
No, you're not. You're all right, darling. It's okay.
It's time for me to go.
No way. We're going
This
to
is
talk about
nothing.
the IPL. You got to watch that first.
When patients start to talk about death or that they could die at any moment, it's a really tricky situation. You don't want to lie to them and say that there's no chance of ever dying, because patients can see through that.
I just cooked something, I watered the plant, and just lie down and why did I get this pain?
So you need to balance it. You need to take a realistic approach, but you also need to just be genuine, calm, and most importantly, distract them.
I reckon a lot of people get chest pain when they do housework.
But until Ravi is checked over at hospital, a serious cardiac event can't be ruled out.
Now, what we'll do is we're going to get you on a wheelchair, just because I don't want to put any extra pressure on your heart.
You people do a wonderful job.
Aw, thanks, Ravi.
Leonard and Amanda are preparing to take an anxious 72-year-old Ravi to hospital for checks on his heart.
I'm telling you the truth.
Oh, that's what we like to hear.
You guys are lifesaver.
I appreciate that, mate. And now I feel really bad because I'm about to give you a tablet that might give you a headache now. So.
Leonard's been doing his best to distract Ravi, who's fearing the worst.
I'll tuck you in. I'll keep you covered up. I know you're a bit cold before.
Leonard likes to put out this persona that he's this very clinically minded person. Now, all it takes is a small scratch to the surface for anyone to know that he is such a nice, caring man.
Ravi, your heart on our monitor looks okay, all right? But basically, we can really only see obvious type heart attacks, all right?
I always respect paramedics more than the doctors.
Oh, more than the doctors?
Yeah, because you are the first people who come immediately to save lives.
We do our best, yeah.
It was pretty clear that Ravi was a fan of paramedics, and I like that kind of compliments. But as a paramedic, I'm used to doing all the questions, I'm used to doing all the history taking, and I can't say I'm the most affectionate person. So it just catches me off guard a little bit when Ravi starts to open up.
Can you hold my hand for a minute?
I can hold your hand. You a bit scared?
I'm 72 years. I have 2 daughters. They are living in London.
Living in London. But you're a good man, Ravi. You're a good man. If there's anything that this job has taught me, is to talk to your family as much as you can.
Yeah.
I know it's hard with your daughters overseas.
So I'm asking Ravi about his personal life, and it becomes apparent to me that he's quite a lonely person.
You still got the pain at the moment?
Yeah.
Has it improved a little bit? You look more comfortable talking to me.
Yeah, I tried to get rid of my pain, talking.
Just talking.
I really hope that Ravi will be okay. But with chest pain, it can be serious, and sometimes you just don't know. I can only imagine that he's scared, and that's completely normal.
I can see you're a fighter. I think you're going to stay around for a lot longer. He was a really nice guy.
He was nice.
And
he
really
liked
appreciative.
You.
Well, I think he was just appreciative of the uniform of the service. I know you're thinking that patients like me, but
They do like you.
I can't take the credit.
Who else is going to hold their hand in the back clinic?
You would have held his hand.
Of course they would have. When a patient says, can I hold your hand, as if you're ever going to say no.
Are you saying that I'm a nice guy?
You are nicer than you let everyone believe. You just want to be a hard ass.
I do.
You're not.
And I keep calling you out on
I know. Damn you. Why do you have to know the real man?
It's time for me to go.
72-year-old Ravi was terrified of dying. But after cardiac trouble was ruled out, he returned home to watch the cricket.
Can you hold my hand for a minute?
I can hold your hand.
Ravi is still very grateful for the care he received.